Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel. This week I wanted to talk about a new patient I saw this week. She's 65 years old. She had a very bad elbow injury, broke the bone. It was a compound fracture, nerve damage. She had two surgeries. One of them was to repair the median nerve, which may not have been very successful, but they basically took a nerve from another part in her bicep and then they tried to splice together the space of the median nerve that was missing. And she had a scar that went all the way down from the bicep all the way down through the inner elbow down to the hand. And her paperwork was saying that her issue was median nerve damage and pain. She said the pain was really indescribable, but the best she could do was to say it felt like a deep cold ache in her arm constantly. So she really had a hard time being able to grasp a pen and write. It was her right hand and she was right hand dominant. So it affects her quality of life and also gives her constant nerve pain in her right arm. And she described a lot of her numbness in the thumb, index finger, and middle finger. So I was also thinking about the radial nerve, and just to tell you what I did to treat it, and then I'll talk about what she said after. I was thinking of muscles that are innervated by the median nerve that I wanted to treat with motor points and electric stim. If you're not aware, electric stimulation acupuncture can act as like a nerve block for nerve pain. So I know you're probably thinking, if you didn't know that, you would probably resist doing any sort of electric stimulation because you might assume that it could irritate and cause worse pain. But in the clinical experience of many people who come through the McMaster neurofunctional Alejandro world, electric stim is used as a nerve block very successfully. So what I did was I used the motor point of the pronator teres, the palmaris longus, the flexor digitorum superficialis, and then the flexor hallucis longus. And I hooked it up to electric stim for about 10 minutes. Everything was moving fairly well. The pronator teres and the palmaris longus were not moving as well as the finger and thumb flexors. But that's kind of what I expected from, someone with nerve damage, median nerve damage. At the end of that 10 minutes, I wanted to see that her fingers were moving better, but I thought, okay, I think based on her symptoms, something's going on with the radial nerve. So I turned her hand over, palm down, and treated the supinator muscle, the extensor carpi radialis longus brevis, and the extensor digitorum communis, thinking the extensor digitorum communis because it was super tight and it's the antagonist that could make grasping difficult for her. You see that a lot. Someone with a weak grasp, treat the antagonist extensors and their grasp is stronger. So I'd already treated some of the flexors, palm up, and now, so I was treating the extensor carpi radialis longus and brevis, and then the extensor digitorum communis. as the antagonist for that. Plus, I treated supinator because the supinator and the extensor carpi radialis muscles can entrap the radial nerve, and I'm thinking if she's got numbness in her thumb and index finger, maybe she has some radial nerve entrapment from her actual accident where she broke her arm. So I treated those muscles, and she did not feel immediate relief from either of those segments of time with electric stim. And then I I was palpating the scar because I wanted to see if there was something that the scar could be causing pain for, like some adhesions, and I was able to find an area of of her surgical scar that was not able to move very well. Um, so I did some sort of surround the dragon threading with very small needles under the scar. To her tolerance, she was fine. I think I put only maybe 6 needles, alternating sides, for that segment. It was probably about 2 inches long, and I just left them in while we talked a bit. Maybe I left them in for about 10 minutes. Took them out. Tried to do some S stretching of the scar as well, and then I used my IASTM um, tool. That's the instrument assisted soft tissue manipulation. Um, so I used some CBD salve for that, and I just treated the whole scar area. She did not feel much improvement, but I did say if this is going to help, it could take several hours or a day or so for the nerves to start sort of coming back, waking up, being a little less painful, especially the numbness in your fingers. So let's wait and see. And we'll book you for next week, and we'll follow up then and see what we need to do. Um, and she texted me the very next morning to tell me how much better she felt. That she felt significant pain relief in that arm. And by the way, she was able to hold a pen when she was done with the treatment. I should have mentioned that she did get quite a bit better grasp after releasing the muscles in the forearm during the treatment. But she didn't have pain relief, and she didn't have numbness relief in the treatment. So the next day she texted me to let me know, and she was very happy about it. Um, I have not yet heard from her going into this week, so I am going to be seeing her for follow up. I am a little nervous that if it backslides a bit, she'll be, a little worried or frustrated, even though I already told her, it could be a process. It could take us several treatments, and there might be some relief that only lasts for several days. So we'll see. We'll see what happens. But I just kind of want to put it out there that electric stim acupuncture on motor points can be very, very successful for nerve pain. I use it a lot for sciatica. In most cases, using it for sciatica for 20 minutes, the patient walks out with no discomfort, no sciatica, and it often stays away at least 3 or 4 days, if not more, depending on if you've gotten everything that could be entrapping the nerve. Um, but that's very typical, for sciatica. I'll treat the glutes for like a deep gluteal syndrome. I'll probably treat like L5S1, of course, and then the biceps femoris, and then the peroneus longus, and I'll let that go for 20 minutes on like 1 or 2 hertz at a gentle rate. You do not want to do 20 minutes at a high intensity. It's just too exhausting to the muscles. And I think the person is going to be way more sore that way. It just wants to be a gentle movement of the muscles so that for 20 minutes doesn't exhaust them. I just kind of want to put that out there. At some point, I guess I want to talk a little bit more about scars and how they affect motor control and how they can cause pain in other areas because of that loss of proprioception. But I just wanted to tell that case, tell you about that case, and obviously, if something comes up with her that is of interest, like maybe it backslides and then it gets better or something like that, I may do another episode about it. But I'm feeling pretty optimistic since she got such a good amount of relief from one treatment that we're going to be able to get her to a much better place, where she's not constantly thinking about the pain and ache in her arm. All right, so that's my little spiel for the week. Um, I may miss recording in the next week or two because I'm going to be in Amsterdam teaching motor point acupuncture. Um, I may not be able to take time to record, but obviously I'll have cool things to talk about when I get back. So I may see you in a week or two, or hear or speak to you in a week or two. And until then, have a great week, and I will talk to you soon.